Okay, so what we're now going to do is really look at what's happening in that kind of midsection of rectus abdominis. So I've just frozen the image because we shouldn't really be scanning for it. We shouldn't have the scanner on when we're not scanning. So what I'm going to look at really is the right edge of the rectus, the medial edge of the right rectus, medial edge of left rectus, lateral edge of left rectus. And it's good to palpate all of these things in patients. I think it's also important to mention that, especially if Von Cauldron's research looked at, that not only is the linea alba changed, but that the muscle bellies of rectus abdominis undergo change also during that pregnancy and into that postnatal period. So we're going to have a look at, well, in an asymptomatic, young, fit and healthy abdomen, what do those muscles look like? And then we will talk through the changes we'd expect to see postnatally, and also we will then have a look at a postnatal abdomen. So I'm just going to unfreeze this. And then what I'm going to do is go above the umbilicus, and I'm going to go from lateral to medial. So let's see what we can see. So I'm at lateral here. I've got these 3 layers of muscle. And then as I move medially, we can see the rectus, or we can see the internal oblique is the big one in the middle. The lower one is transversus abdominis. So if you just do a nice breath out and draw the tummy in. Big effort. Good. And let go. And again, breath out, draw the tummy in. Good. And let go. So that's really confirming that that's that transversus. Internal oblique, middle one. External oblique is the upper one. And as we go, we've then got that lateral edge of rectus abdominis. And this nice big kind of plump muscle is the right rectus abdominis. And then we can see where that muscle ends and that projection out, almost that bridge out from it, like that kind of swordfish. And what's very unusual here is we can see the exact starting point of the linea alba. So if you just do a head lift and down, that really confirms to us that that's rectus abdominis. Just do a head lift again and then down. And then if we go more laterally, or sorry, medially, we've got the starting point. And what you see in either a nulliparous patient, female, someone with very good abdominal tone, is you can see the linea alba as a bridge, very fine bridge, crossing to the well-wrapped, clear fascial lines of the left rectus. Come back over the linea alba. So that's the right rectus abdominis. Linea alba, that bridge. Left rectus abdominis. And what's unusual here is that that left transversus has ended very far medially. So that's a nice image. So we're now on the other side. So we've got the lower transversus abdominis internal oblique, external oblique. If we go back to the midline, we can see the internal oblique really investing rectus abdominis, but that transversus continues a good bit medially. What we tend to see here, which we won't see in a lot of our patients, is a very clear fascial lines, almost like they've been painted on, but a very fine brush. And we can see that bridge, almost like the Severn Bridge running across. And we can see the sides are different. On the right hand side, the transversus ends much sooner than it does on the left. Let's see what it's like inferiorly. Could you just put some gel on the probe, please? And it's important that we look at patients both superior to the umbilicus and inferiorly. So we're now going to go a couple of inches underneath. So we're on to the big rectus abdominis. Just do a little bit of a head lift for us. Good. And then down. So this looks completely different. We're on the left rectus abdominis, right rectus abdominis, but we have lost the Severn Bridge, because the Severn Bridge has now become a very small block in between. So we've got a tiny joining left rectus, right rectus. Whereas superiorly, it looks like we've got the bridges back. As we go below, they're very close together. Go closer again, they're almost like what we call these kind of kissing muscle bellies. And that really reflects the anatomical structure. That reflects clinically, you know, when we look at people who are nulliparous or males, the distance is lower inferiorly. When we look in patients, we tend to measure superior and inferior, the distance is much smaller inferiorly. And I think things to highlight here is the very clear fascia we can see, very clear lines. We can see a definite end to the rectus abdominis. We can see a definite Severn Bridge effect. We can go the other side, whether we're in, now we've jumped over to Wales. Transversus coming in. What you see in patients is you see real disruption in that very fine lines. You see disruption because you get stretching, you get tearing, you get a very haphazard fascial structure, and that also tends to fit in with the quality of the skin also. And you also get more depth in the linea alba, so the depth from the top of the screen is much, much greater. So I'm just going to turn this off.